Yeah, let's assume that this is our rectum. You remember it will start from the sigmoid colon, right?
Yeah, from
It's,
sigmoid colon.
So then we are going to be having so, but in the rectum there is what we call pectinate line.
Which line?
Pectinate line.
Pectinate line.
Pectinate line. This pectinate line divides the rectum into lower or inferior parts, inferior rectum, and above superior rectum. Superior rectum. So now, this one, it is not only cancer that can affect the rectum. Please note this. Other things that can affect the rectum are we have
You mean that diseases that can occur in the rectum?
yes, rectal prolapse. It means that if you do rectum today, all diseases that will affect rectum, you know them already. You understand? Even now they ask about cancer of the rectum. If you continue to study, you will see they will ask you how you will treat rectal prolapse, how you will treat hemorrhoids,
yeah.
how you will treat paraproctitis, like this one. So rectal prolapse. Another one is hemorrhoids.
Bleeding, yeah.
Hemorrhoid, but you know, hemorrhoid is not just bleeding. You understand? It is hemorrhage that is bleeding, but hemorrhoid, it is dilation of
Blood
the
vessel.
rectal veins. Yeah,
Rectal veins.
Okay, rectum. And then we have paraproctitis, and then we can now talk about rectal tumor. So you understand, these are main diseases that can affect. So this one, they are the known tumors. Why this one is the tumors? You understand?
Tumors?
Tumor.
They are
cancer.
tumor, but they are not.
Yes, this is tumor now. Cancer of the rectum. They ask about this in this question.
Correct.
But now in the rectum, you can have other diseases that they are not cancer.
They are not cancer.
They call them known tumorous diseases of the rectum.
Of course. Yeah.
Known tumorous diseases of the rectum.
No problem. They're like rectal prolapse and hemorrhoids.
All these three, you
All
and
those three.
paraproctitis.
Paraproctitis.
Okay. Now, but our problem it is how we will treat cancer that is affecting the rectum. But first, you should know what part of rectum. We have three parts of the rectum: superior, middle, and inferior. And then, but primarily they divide them into two, because in the middle only shows where the superior and inferior, where they meet. So the superior part of the rectum, the blood supply is from the portal vein. Portal veins, and the blood supply of this one is from like the rectal vein, like a systemic vein. You understand? Like we have portocarpa. You understand? You remember about this thing? Portocarpa anastomosis. But you pay attention to this one later. This portocarpal anastomosis is also an important thing for you to know in anatomy, so that you'll be able to answer a lot of questions relating to some diseases, especially that one affect the liver and that affect the rectum. Okay, so now we want to talk about, now you already know we have three parts of the rectum: superior, middle, and inferior. The inside part is primarily made of something like intestine, but the outside part, it is something like that makes like the skin. So if problem affects the lower part of the rectum, you will feel pain, but if it affects here, you will not feel pain. Okay, So then, method of treatment now of the of the rectum. So we can have such the such surgical treatments, because treatment because as a method of treating all forms of cancer, you can have anti-cancer therapy, right? Anti-cancer therapy, which is treatment with drugs, you understand? Therapy. You can have radiotherapy,
Radiotherapy, yeah.
and then we can have surgical treatment. Okay.
Alright.
So now here, since it is Department of Surgery, you understand, then you should know that surgical treatment is what they are. So now we are going to treat rectum in such a way that we, depending on the location of the rectum, so if we have the tumor in here, in the upper part of the rectum,
Upper part now.
if we have it in the upper part of the rectum, we can like cut that part of the rectum, you understand, and then we cut some part of the sigmoid colon.
Sigmoid colon.
Okay. And so, and then they call it resection, rectal resection. So what you do after this, now you are now going to do, you just remember, we do rectal